Study your cases, read the basics, rapport, learn to have fun on the side, and ground your anxiety. Hey guys, it's me again, Audrey from Cebu City, and for those who don't know, I am a medical student here in the Philippines and I'm studying now in the hopes of becoming a better physician, one scribble at a time. Internship is the best year so far, and after this, it's the real world. So, akong gisuot karon ako ang internship uniform. Don't worry, para feel man sad ako, di ba, na intern pa ko. Internship is a time where you can meet a lot of people from different age groups and also different schools, and hopefully internship syndrome wag hopya kay everything that will happen right now is a crossroad, and remember that you are here to learn holistically. So here are my top 10 tips for you to survive physical therapy internship and sana naman, road to most outstanding intern, and let's spill the tea. Tip number 1, friendships and career. Now if you're inside the clinic, learn as much as you can, but if you're outside the clinic and you're already done with your shift and layo pa ang Grande Valida, girl, learn to have fun and build friendships on the side. Apilin na lang siguro kilig para i-avail na dyan yung tanano, pero ayaw sad palabda ang ulo mo ni Papa, no? Ayaw sad palabi. Anyway, all jokes aside, this is good for networking if you think about it. Tip number 2, build your rapport. Even though how good you are and how smart you are during college days, but you don't know how to converse to your patient and to explain to your patient in the simplest manner that they could understand their case, or you seem stoic, will never go back to you. This is also your time to practice as a physical therapy intern. Build professional interpersonal relationships with your patients with conversation starters such as, "Hi ma'am, ako si Audrey Gravador, ako ay mo physical therapist karon. Kumusta naman day karon ang imong tuod or imong likod?" Or while you're taking your BP, "Ma'am, kumusta naman ka karon? Isa ka sa hagdanan or nag-elevator ka? Niinom ka og kape? Niinom ka karon sa imong tambal? Ay bag-o pa day ka naabot karon? Sige, unya na lang ta mag-BP mga 15 minutes para mo kanaog pagamay atong BP ha." Part of good rapport is also taking care of yourself by going to the gym or working out. In my opinion, this pays a lot considering that board exams will really take you to the heavier side. And on the internship side, this also makes you stronger and more confident to lift your own patients. Tip number 3, learn from the chief physical therapist. Now, I can vividly remember one terror chief physical therapist from a certain hospital, but then to be honest, he is one of the people that I really want to be in the future because he never stops learning, and that's how you know that he's good and he's really sought after by VIP clients and patients. Now, he's a type of chief physical therapist that asks for the normal values for ROM, what special tests that you are going to perform to this patient, which ones are supposed to be placed in an IE, high-yield board exam questions, and aside from that, conduct and your attendance.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't.
But what he's looking out for is your work ethic. So just be ready to print your blank IE ahead of time because you'll never know what happens. Just kidding. Now, especially if your chief physical therapist has a specialty that you want to go to in the future, go and learn from him or from her. One pro tip that I learned from him is to never take your proper body mechanics lightly to reduce your chances of mechanical low back pain in the future. Now, this also makes your rehabilitation intervention more effective and more efficient. Now, for example, if your patient is having trouble performing the plank push-ups, he or she can try the wall push-ups first, which is not gravity assisted, and then they will have to try the V push-ups once the wall push-ups are already good, and afterwards, they can now try the plank push-ups. Now, especially if your chief physical therapist wants someone to help him do it. Now, don't be afraid to touch your patients, and experience comes with time and skill. There's one way of taming your anxiety is to breathe in and face it. So tip number 4, read the basics. So especially some common cases such as your low back pain and your ACL sports injuries during summer would really take into account ROM measurements for your initial evaluation. Now, especially if you don't know the normal values and the proper axis and placement for the joint or the movement that you want to measure, it would really be time consuming for a 1-hour rehabilitation session. Your clinical instructors are actually observing you and grading you. Now remember, in TBI rehabilitation, it's either you use it or you lose it. And aside from that, how can you treat your patients and how can you explain it to them in the simplest manner if you aren't reading. So you can't just touch your patients and treat your patients just by being friendly. And this is your only time for you to make a lot of mistakes because this is your middle ground. You are a student who is not licensed and you are still testing the waters. Since you are not licensed, you are guided more compared to when you're already working. Okay, so therefore, open your TerraX books for home exercise programs, and there will come a time where your clinical instructor also wants to revise a certain program for your patients. Now, one tip that I can give you to boost your creativity in your rehab sessions is to check the rehabilitation portion of Pinterest and infer if this would be a good addition to your exercise program. So make sure the P's come from authors that are part of the rehabilitation team, such as SLPs, PTs, OTs. I personally used this for my pediatric rehabilitation rotation and it made my routines more enjoyable. Tip number 5, this is the perfect time for you to review the medical abbreviations and medical terms. I know this is one portion of the subjects wherein students don't really focus on unless it's exam time, but since you're already an intern, it's part of the clinic and in the real-life setting, it pays to take note of the medical abbreviations, especially the common ones, because it saves time, your work is more efficient, and most medical professionals understand it. And aside from that, this book will also help you how to write your initial evaluations better. Tip number 6, try to chill your anxious self. Now, how do you ground yourself? You're only 1 year before your board exams. Sounds chill, right? But imagine how you would feel if there are only 3 months for you to cram the 5 years of your life as a physical therapy student because it's already board exams. So chunk your Grand Revalida study sessions, take your in-house review seriously, and you can also start reading board exam questions. You can start with as little as 50 questions a day and you can go to 100 if you feel more comfortable. Some people don't even feel like 500 questions is a challenge once you get used to it. One type of study routine that I could pay forward to you is the famous Gravador technique. Now, it's a type of study routine where you have to work for 25 minutes and then take a short break for around 3 to 5 minutes on the first cycle. So once you're done with the 4 cycles, then you can try a 10-minute break. I personally have a study schedule of at least 4 hours before taking a break because 25 minutes for me is enough so I could be in that study zone. And I personally like the continuity. So once I'm done doing whatever I want to do, or if I have ticked off one box from the checklists, then I take the coffee break and then listen to music, watch 25-minute Netflix episodes, okay? And then I start again. So one tip, I was also quite lost as to which review books I need to start because, I don't know, I just felt lost. I just felt lost because at that time, we didn't have the extra push as to we will be doing GAL's exam for the next week or for the next week. We will be doing Fortenberry or next we will be doing GAL's and Saunders. Now, for me personally, what I did was I started with GAL's first because it has a good rationale, and I went for Fortenberry after because it has a good reviewer rationale for pharmacology. Tip number 7, take evidence-based practice seriously. Clinical instructors will give you a certain Revalida topic in conjunction to a certain journal that you will be researching. So for example, if your case or your patient's case is about osteoarthritis, then you have to look for an evidence-based journal about osteoarthritis. And some rotations even permit you to share that journal in front of physical therapy interns, physical therapists, physiatrists, and PM&R residents. From what I know, it happens in Vicente Soto Medical Center and also in UP-PGH. And don't take this for granted because since physical therapy is evolving, there are some rehabilitation techniques that are not found yet in books but are only found in journals. And this is the core of becoming a good healthcare professional, which is to provide quality treatment to your patients. Tip number 8, learn a foreign language. And I know this is striking, and let me be honest, and let's be honest to ourselves. You want to go abroad, and especially if you want to live in the United States, there are a lot of Spanish speakers. If you want to live in New York, or you want to live in California, or even Chicago, or in Canada, where they would give you a higher point in the immigration status if you are fluent in French. Now, there are actually good apps that could help you get through that, and one of the popular apps is Duolingo, or you can just hit my closest friend Marlon Quizon. For more details and inquiries, just click on my comment section down below. Okay, this is not sponsored. He's just really good in 8 or 10 languages.
Привет, Прasta. No, Prasta. Привет. Меня зовут Марлон. Я говорю по-русски чуть-чуть, потому что русский сложно, русский очень сложно imparare l'italiano. Perché l'italiano e lo spagnolo sono molto simili e per questo è tanto difficile per migliorare. Sono confuso qualche volta. Alors maintenant je parle en français. Alors j'étudie français depuis 6 mois peut-être, comme ça. Mais je pense que je parle français comme une vache espagnole. C'est une expression en français qu'on dit broken French. Je sais pas comment on dit en français, mais c'est ça aussi. Me estoy enfocando con mi francés, por lo tanto no tengo mucho hueco para estudiar o mejorar mi español. Además, creo que la gramática en español es muy complicado también. Hay muchos vocabularios también en español que tenías que aprender y sí, cosas así. Y las personas hablan muy rápidamente, o muy rápido, de verdad, perdón. Perdón. Y hay muchos acentos en español. Tengo un amigo de Barcelona y habla muy rápido, de verdad, y es muy difícil para mí, me cuesta mucho para entenderla, pero...
From what I heard from my friends who are starting their immigration papers and their student visa applications, most people who want to migrate to Canada stay away from Quebec because of the heavy language barrier. So if you want to leave faster, you might as well take that opportunity rather than saying a big no to learning. Because one way or another, when you're already working, okay, you would regret not even learning just a little bit. Tip number 9. This is the best time for you to evaluate whether you want to become a physical therapist or a doctor of medicine in the future, because physical therapy is a good pre-medical subject, especially for those prospective students who wants to become an orthopedic surgeon, a neurosurgeon, maybe a little bit of radiology because of anatomy and because of some radiologic subjects that we have, most especially PM&R or physical medicine and rehabilitation. There may be times where doctors might need your help during an EMG or during scoliosis exams. So do it. Maybe it might spark your interest. Also, it's a good tip that you would let them know who you are, so in case that you want to volunteer in their institution after you have graduated and taken your licensure exam and you passed, you are already a familiar face. Now, for those people who wants to pursue their doctorate of physical therapy degree, I am paying it forward since I'm not pursuing it anymore. I have an unofficial tabulated document that I personally did, wherein it focuses on the doctorate of physical therapy schools, the tuition fees, and also the cut-off GPA. So if you want to know more about PM&R, please comment down on the comment section below and let me know about it. Tip number 10, this is the most important, and if you are on your way to become the hashtag road to MOI, set a goal, no lates, no absences. Although you're still a student, this is one step closer to adulthood. So what you do now is a reflection of your work ethic once you're already working. This opens a lot of opportunities, and having no lates and absences is the biggest criterion to becoming an MOI. Technically, from what I know, correct me if I'm wrong, if the whole batch has lates and absences and demerits, even if you're the top student and you are vying for that MOI, there would be no MOI for that batch. I want to mention that 2 of my closest friends, Nikki and Kim, became the MOI of their respective batches. So when Nikki got her license as a physical therapist, it wasn't that long that she became a clinical instructor from a renowned hospital before she left for New York. And Kim, on the other hand, also became a clinical instructor in one of the really renowned hospitals here in Cebu City. So, diba? Goals? Thank you for watching. I'm paying it forward, and I hope that my clinical notes and other documents in the description box would help you and it would go a long way. And always remember that if it can be taught, it can be done, and you can overcome it. Special shout out to Velez Physical Therapy interns who are on their way to internship. So, live a life you'll never regret. Bye!
Naman. So, Rick, what can you say about that?